Thank you very much, Mr. Speaker. On October 29th, the NDP released a letter from a group of pathologists expressing very serious concerns about the proposed privatization of medical lab services in the Edmonton area, including concerns about quality and timeliness and the transfer of a key public medical service to the private sector. According to this report to stakeholders debated just November the 13th, AHS's response apparently is to give vague assurances of consultation and to set up some committees. My question is to the Minister of Health. Why is this government ignoring the very real concerns that have been expressed by your own expert medical professionals?
Mr. Speaker, we've explored this issue at length in the legislature. I'm glad to see that the honourable member is seeing the evidence of the consultation that is underway between Alberta Health Services and its various employees. Mr. Speaker, this issue will not be determined by opinions held about ideology with respect to private and public delivery. This issue will be determined on a measurement of quality and providing state-of-the-art lab services for the citizens of Edmonton and Northern Alberta.
Honourable Leader.
Mr. Speaker, this last statement from the minister is simply not true. The government has predetermined that this will be a privatization, and there is clearly no intention on the part of government to even consider developing this facility within the public sector. So great is their concern that all 90 pathologists, as well as medical doctors and researchers, have formed an organization to fight this privatization. They remain opposed to this high-speed, forced privatization and the impact it will have on their patients. They have written a second letter to the minister. Will the minister please tell the House what his response to these pathologists is?
Mr. Speaker, the pathologists are one of many stakeholder groups within the healthcare system that have been consulted on a regular basis for quite some time now about this change. And Mr. Speaker, again, the change arises from the fact that a very important contract that provides for a lab facility in Edmonton today will expire in 2017. Mr. Speaker, the honourable member does a disservice to frontline workers in the health system by suggesting that they would be guided by anything other than what is in the best interest of their patients. This is a major decision, Mr. Speaker. We'll carry on the course that we are, and we'll continue to consult with people.
Honourable Leader.
Mr. Speaker, well, it's rather tiresome to keep hearing from the minister that when we ask legitimate questions about his policy that we're attacking healthcare professionals, frontline healthcare professionals. It's tiresome, Mr. Minister, and you ought to stop it. There's a huge public interest that's been identified by these pathologists about this privatization, a privatization the scale of which would make Ralph Klein blush. We know that there's going to be significant impact to patient safety. Minister, your own professionals are telling you this. They deserve to be answered in public. Will you provide a detailed response to these concerns as the Minister of Health and make it public? And if not, why not?
Mr. Speaker, as I've said, and quite frankly, what is tiresome also is being asked and answering the same questions over and over again. What I will tell you, Mr. Speaker, is what I have said consistently, is that quality of patient care and quality of service and access to the best possible level of lab services for the residents of Edmonton and Northern Alberta will guide this decision. As with public providers and not-for-profit providers, private providers in this province will continue to be held to the same quality standards.